the nursing metaparadigm concepts is what we talked about last class, and we talked about them as they apply to all nursing theories. And you have to use metaparadigm concepts in order to have a nursing theory. And the nursing theories had to work out ways to make sure that all of these four things are met. Otherwise, it can't be a nursing theory, right? And so these are the major concepts within nursing theory that each theory looks at and addresses. They look at person, or the person or individual receiving care. They look at health, or the state of illness and wellness. They look at the environment, which is where nursing happens. And they look at nursing, the actual act of providing care to patients. So in order for a nursing theory to be a nursing theory, it must look at the four metaparadigm concepts through their own lens or angle of thinking about these things. So we talked last class about Florence Nightingale. Does anybody remember what her really important thing was? The environment. Yeah. So that's exactly right. She was really focused on the environment, right? That was her lens that she looked through everything. So the environment for Nightingale was the most important, and she said that without having a good environment, patients could not get better. We needed to make the environment as good as possible so that God or nature can do its healing on the patient. She believed that nursing assisted nature in healing. We assisted patients to get to a good environment so that they could be healed, rather than actually doing specific skills. Who did she say was the person receiving care? Do you remember? The patient. The individual patient, right? She didn't focus on the family. She didn't focus on the community. The individual patient was the person receiving care. And health for her, does anybody remember what she believed about health? Yeah, exactly. You're right. So she believed in ventilation and separating patients and all of that. You're right. And she focused on her idea of health, though, was that if you are either healthy or you are sick. So if you have any sort of chronic disease, like you said, or anything like that, you would be considered unhealthy and not a healthy person. And so Florence Nightingale very much had black and white beliefs about health, right? You either are healthy or you are not healthy. So this was her idea of looking at the metaparadigm concepts. And now we're going to move on to talking about other nursing theorists and their ideas of these concepts.